Doctor, thanks so much for being here. As always, we're still hearing people, including the president, saying things like young people aren't getting COVID-19, they're not getting sick. There's a CDC study that found the median age of people with the virus, that's getting lower. And people in their 20s are accounting for most new cases nationwide in Massachusetts. So what's the deal here? Why is this happening, and is this even a problem?
It is, Maria, because what this study showed was way back when, in the beginning, the COVID-19 older patients, okay? But what we realized was this summer, it was affecting between ages 20 and 30 years, okay? So a younger population. But here's even more importance. What we saw was that about 4 to 14 days after these patients were turning positive in this younger age group, we were seeing an increase in rise in the over 60 positivity. So the younger patients are giving it to the older patients. That's the real problem.
Let's talk about the state of New York. New York's governor says that state will do its own evaluation of vaccines as they become available, because he's flat out saying he doesn't trust the government process, especially after the president threatened to override FDA's rules. So here's a basic question. Can a state do that? And how unusual is that?
Right, so obviously this would be unusual. And I think what's really important here is that with crisis communication and management, we need a singular voice. We need all of these different regulatory bodies to come together and send a unified message, because these mixed messages are giving the public mistrust. And when it comes to vaccines, at baseline, there's a sense of mistrust. What we want to see is that the independent data safety monitoring boards of these companies basically tell us that the vaccine looks safe and effective. It's not a question of when. Right now, this is still a historic record pace for development. What we want to see now is that these vaccines are safe and effective, then ultimately get approved by the FDA, recommended by the CDC, and we don't want to see an override by the department, the DHHS, which oversees the CDC, the NIH, and the FDA.
Right. So should people be worried if a vaccine is suddenly ready in October or November? In that case, I mean, you're talking how quickly it might be on the horizon?
So not only do we want to know that this is safe and effective, but we want to make sure it's effective in the groups that are the most vulnerable. We want to see the subgroup analyses, effectiveness in the over 65 age range. We want to see that it's effective in patients with chronic conditions, in a racially diverse group. It's not a question of when. We want to look at the data, follow the science.
The CDC director is saying about 90% of the U.S. is still susceptible to COVID-19. What does that mean in terms of herd immunity? And then fold in, how does a vaccine factor in to all of that?
Right. So what it tells us, as you know, you've heard me say this before, we think herd immunity would take between 50 to 70% of the population to develop antibodies and become immune. We're not even close to that. And we know with around 10% of the United States having antibodies, there's been 200,000 deaths. So if you use that math, we're not on a path to herd immunity. Now, the vaccines, of course, can help. But again, first we have to make sure it's safe, effective, and then see how durable, how long is the immune response that's given by the vaccine. Those are unanswered questions that we need before we can give a green light.
Dr. Adler, thank you so much for your time.
One day at a time. Thank you, Doctor.
One day at a time.